So, I guess maybe 6 or 7 years ago, I had probably put on 40 or 50 pounds, and I had major pain in both of my knees. In fact, in my left knee, I didn't have any range of motion. It was so much pain that I couldn't go up and down the stairs. I had really almost stopped exercising completely, and the the thing that was most depressing is I was at a time in my life where I was going to see a doctor. The doctor was actually telling me that I was bone on bone, and I thought I was actually going to have knee surgery or knee replacement. And at 47, 48 years old, I just did not want to go through that process. And so I'd heard about the lipogems, and I'd heard about some of this experimental research. I knew Dr. Farrell, and at first I was a little wondering whether or not I was going to do it, because it's really kind of hard to believe that you can use something as so non-intrusive as a needle in your knee to actually have healing done inside of your knee. And I actually had it also in my shoulder. So the first thing I did is came in for the evaluation, and like I said before, I kind of knew this. I was bone on bone, and Dr. Farrell here said, "Hey, listen, we're going to try the lipogems. We're going to first go through the process." I got lipogems in my left knee, and then also in my right, and then same with stem cells. The lipogems, the process is kind of weird. It's one of those things where, it's really kind of sci-fi. They take down your blood, they spit it down, they put it back in your knee. And my knee swelled up for a while, and it was starting to heal. I had physical therapy for like 6 months, and I had to keep it straight. But within 3 or 4 months, I could feel the difference. I could feel the difference especially in my left knee. And after a while, through the physical therapy and then coming back getting checked up, I was able to get some range of motion. But 6 months later, I'll tell you, it was like night and day. I could move again, and because I could move again without the pain, I had range of motion. Before, I had no range of motion. Getting in and out of the car was difficult for me. Like I said before, I couldn't run at all. Now I actually do my elliptical. I go up and down the stairs with no problems and no pain. I actually do. I know Dr. Farrell wouldn't want to hear this. I've started to run again, and I have little to no pain. And to think that just 4 years ago, I was in so much pain that I was really kind of giving up on doing anything that was non-intrusive, because I thought there was nothing out there. So it's really transformed my life. I've lost 45, 50 pounds. I've started, like I said before, the exercise. My continence has changed. I just feel so much better, just overall. It's amazing that something like knees has such an effect on my life. And so that's kind of where I am today. I'm very pleased with what's happened to me. And I tell everybody when I can how transformational this process has been. I've talked to members at my church. There's one person and it's such a shame. You can see someone with knee problems, because what they do is they hold their knees and rub their knees when they get up and get back down. And it's so funny, because I'll look over, and there's someone else that I know. He's a friend of mine, and I see it, and I say, "Listen, you got to give this a chance." I know, and he's already talking, "Oh, I'm just going to get knee replacement." This person was in the Navy, and he was like, he's always had knee problems, and he still doesn't want to come in. But I noticed that maybe 3 or 4 months ago that he was rubbing his knees, and I just told him, "Hey, listen." And he went to a doctor as well. The doctor told him he was bone on bone. And I actually tell him that it is non-intrusive. You do have to do the physical therapy. You do have to keep your knee in a place where it can heal, where you're not moving it. But other than that, discipline that you have to have, everything else, the actual solution, it heals itself. So when I try to explain to him it's a regenerative process, it is. Even me, I remember that feeling as, is this hocus pocus? Is this kind of voodoo? But Here I am now, like I said, here I'm 4 years later, or 3.5 years later, and literally there's no pain. And he noticed I don't rub my knees, I don't get up, I don't have to make that sound. Men make the sound when they get up when they have bad knees, and it's just it's amazing. So I try to tell anyone that I see, because I know how it feels, and I know how I can even kind of get you down, that you can't move like you used to. You're in constant pain. I was taking Advils all the time. And so I try to tell anyone, hey, listen, give this a try. I know it's not 100%, but give it a try before you do the knee replacement, because once you do knee replacement or knee surgery, it is intrusive. You are down for a while. And that is putting, especially knee replacement, that's putting something artificial in your body. This is your natural blood back in your body, working to heal itself. It's just amazing. I can't say much more than the bedside manner that's shown to me here. You come here, everyone's a professional. Everyone knows what they need to do. It's not as simple as someone would think, because it is putting a needle in parts of your knee and then injecting it. But the process has to be clean. It has to be sterile. Everyone around, they know that, especially when you do the lipogem, they have to take lipos are fat. They have to take fat from one part of your body and actually blend it down with blood to put it in your knee. And everyone knows their roles. Everyone's kind. Everyone has, like I said, they're courteous. They're knowledgeable. And in turn, I was kind of surprised, because I know this is a new science. I know this is an emerging technology, but yet you have people that they are also zealous for the technology. They're zealous for the practice, so they take it serious. And that's a culture that that the doctors here, they just take it serious. And so I'm just pleased. And off and on, I still come back for a checkup. I don't need the lipogems or the PRP as much anymore, but I still get what's called prolotherapy, which is the doctors here call like Kool-Aid for your knee. It just makes it feel better, and it's very non-intrusive as well. But like I said before, I had lipogems, I've had PRP, which is plasma, and stem cells, and I've also had the prolotherapy as well for my knee. So all three, and folks here are great, and I can't say much more about it.